IVF is the treatment which gives the best success rates of pregnancy. The other treatments for infertility like ovulation induction, intrauterine insemination, those do not have the high chances for pregnancy. IVF in the whole world is the treatment which gives the highest success rates for pregnancy. IVF is just suitable for men suffering from fertility problems with low sperm count, low motility sperms, and in men with no sperm in the ejaculate. In the old days, those men were not able to have any children. With the IVF treatment, and especially with microinjection, now men with sperm problems can also father children. So it's a good option if there is a problem with male partner. IVF is also very successful for women with tubal problems, with tubal obstruction, or women with low egg count, or women with polycystic ovarian syndrome who do not respond to previous ovulation induction treatments, or women with many women with endometriosis. So the indications for IVF changes in endometriosis. There is no problem for IVF initial assessment either in men or in women, but the couple cannot conceive in the last year. This is called unexplained infertility, and in also these couples, IVF works very well. So the indication varies among couples, but the success rates are really high, depending mainly on the age of the woman. So if you're planning to have IVF treatment, the age of the woman is the most determining factor, so don't be late for IVF treatment. In men, there is no such problem as age, for men's age, but women is the one who is determining the success rate for men's age. Because other than the age of the woman, the number of eggs and the quality of the eggs also depends on the woman's age. So that is why it is much more important than men's age. Men can father children so that whole their lives. But there is a biological limit for women, which is nearly 45 years of age. After 45 years, we cannot achieve success with the IVF treatment. With we cannot achieve. With donation, it's really high. With donation, you can be a mother at any age, donation of eggs. With your own eggs, it's not possible after 44 to 45 years of age. Right. IVF treatment in general has 4 steps. The first step is the initial assessment, and after the initial assessment, we just have a program for you. Depending on your characteristics and your husband's characteristics, we have a treatment plan of IVF. In the first step, we start with the egg stimulation. There are small injectables, very small tip needles, and you can apply them yourself at home. And this lasts for like 7 to 8 days or sometimes 10 days. During with these daily injections, you start growing eggs. When you grow eggs, we measure them at the ultrasound under ultrasound guidance every 2 to 3 days apart. We just measure the size of the follicles and the number of follicles. That shows your response to the gonadotropins, the injectables we give you. When the eggs are ready, after 10 days, we do a last trigger. That trigger makes you ready for egg pickup. The egg pickup is done in the IVF laboratory's operating room. In Turkey, we usually use anesthesia. The anesthesiologist will be with you. With an IV line, you will fall asleep like 10 to 15 minutes. We go through the vagina. Under the ultrasound guidance, we see the follicles and we pick up the eggs. The laboratory is nearby the operating room. In the laboratory, there is embryologist that simultaneously checks the follicles, the follicular fluids, and checks the eggs. When you wake up after the procedure ended, you know the number of eggs. And after the day you do the egg pickup, the day after you will learn if they are fertilized or not. Then they become embryos. Then we follow up the embryos day by day by embryologists, and after 3 to 5 days, the embryos are ready for embryo transfer. So the first step is egg stimulation, the second step is egg pickup, the third step is producing the embryos, and the last step is the embryo transfer. These 4 major steps are the steps of IVF treatment, but these might change from the couple to couple because the treatment plan might consider total embryo freezing. The treatment plan may include embryogenetics. The treatment plan may be another drug protocol with long-term treatment. So it's not the same for every couple. The time schedule might change, but these 4 steps will come in IVF treatment. The important factors before starting the IVF is choosing an IVF center and choosing the doctor. After you decide where to go, you're ready for the treatment. This is the first and major step. When you start the treatment, you should be aware that the laboratory's blastulation rate is the major determining factor for those IVF labs' success rate. So you need to ask how many of the embryos go to day 5? What's your pregnancy rate? What is the live birth rate from your IVF center? These are the questions to be asked. Because if the laboratory works well, you have the highest success rate for you after this treatment. When you start the treatment, you should be ready mentally and physically for the treatment because this is a hard treatment. Psychologically, you should be good enough to have the treatment because you will have an expectancy of pregnancy at the end, but sometimes it doesn't end up with pregnancy, so you will be good enough because it will be a challenging treatment. When you start the treatment, you will start with the injections. It might be hard for you at the initial step, but we have nurses, we have staff to help you. We will help you for all the steps throughout the IVF treatment, all medically and also psychologically. It's not hard to do the injections every day, but you need to be in the place, in the same city, through that 1 week period of follicle growth, because if you stay somewhere else in another city or far away, it will be hard for you to come every other day for an ultrasound checkup, and there will be some blood tests during that period. It's better to stay at the same city during that follicular growth period, the extubation period. The egg pickup is not too hard because you will have anesthesia, like 10 to 15 minutes. With the anesthesia, you will not feel any pain, and you wake up. You might have some pain in the lower abdomen, but it's not too bad. With the analgesics, it will be over in 1 day. But if you're having too many eggs, like 15, 20 eggs, the pain is much worse at that time because when you have too many eggs, your ovaries are bigger. That makes a little bit discomfort in 1 to 2 days after the egg pickup also. This procedure is not very hard for you to undergo the egg pickup procedure. After the egg pickup procedure, you have 3 to 5 days free, waiting for the embryos to develop. When the embryos are ready, the doctor will call you once more for the embryo transfer. The embryo transfer is not under anesthesia. You will not fall asleep. It's very easy, no pain. With small plastic cannula under the ultrasound guidance, we go into the uterus and put the embryos there and wait afterwards 10 to 12 days for a pregnancy test. In my opinion, the worst part or the hardest part for you is to wait for 10 to 12 days because we want a good news, but waiting is very hard. But if you're staying abroad, if you're planning to come here only for treatment, after the transfer, 2 days after, you can go back, you can fly back, and you can have the pregnancy test at your home, but please let us know what the result is. And before starting any IVF treatment, your medical conditions has to be optimized. If you're having diabetes, it has to be regulated. If you're having hypertension, it has to be under control. If you're obese, please try to lose weight. If you're smoking, please quit smoking. If you're having alcoholic drinks, please stop having any. If you're just drinking too much coffee or tea, please change your lifestyle. If you're doing a lot of sports every day, then during the egg stimulation you cannot have sports, so you have to arrange your meals or diet according to that. You have to stop doing sports for a short period of time. After the embryo transfer, no sexual intercourse. You also have to change your lifestyle until you know if you're pregnant or not. So this also needs some preparation for you, and you need to be feeling good enough, strong enough before you start the treatment. Some patients have bad histories like pregnancy losses, many failed IVF cycles. They come to the treatment when they're not ready. Please be good enough, feeling good enough before you come to the treatment, because every treatment is different. And when we start, you have a new chance. Never forget that. Forget about the bad histories, and we start with a new good treatment.